Dr. Githinji, who's the Group CEO of Amref Health Africa, joins me now. Dr. good evening and thanks for making the time for us. So, some good news with the vaccine. How significant will this be once this lands in the country?
Thank you, Yvonne, and thanks for having me as always. And the vaccine is obviously globally a major development in the fight against the COVID pandemic. For Kenya specifically, it is a significant step forward because we didn't know when this would come, but now we know that in the next few months we may be able to get this initial dose. But please remember that this vaccine, the initial dose that we receive, will be focused largely on health workers. It will be focused on people who are living with diseases like diabetes and hypertension, and will be focused on the elderly. Those are people above 50 years. And also it may be focused on people whose sectors require them to come in, or put them at risk, like teachers and security forces. So the rest of the general population will still have to wait a little longer. So it will allow health workers to continue to do what they need to do while reducing their risk of infection. So it is a major significant step, Yvonne.
All right, so let's talk about, what COVID-19 has looked like in the last month or so, because we're now in the festive season. From your estimation, how have we done over the last 30 days or so, even as we try to see maybe what the festive season will look like?
The first thing to say is that, you remember we had the first surge, and then we had actually good control. And then after that, of course, the economies have to open because the closures of economies is not compatible with livelihood. So after the economy started to open, we saw socialization increasing. Remember, we've talked on this platform and talked about the key factors that increase the risk of infection as being in closed spaces, close contact, and congestion or crowding. So those factors came together. Now we've seen a second rise and obviously movement to new counties beyond the cluster around Nairobi and Mombasa. But now we're seeing that coming down, and we have also seen the number of people who require hospitalization, the people in the ICU, coming down. And this has to do with the increased with the curfew hours, for example, reducing the time of socialization. So we have done well, actually. The one thing I can see is that obviously we have seen challenges of providing people with ICU beds when they need them. We've seen challenges of adequate oxygen. We've seen people shuttled between county to county, which tells you that our health system is still not adequate to handle a surge, which therefore means it's extremely important to keep the curve flatter than it currently is.
Okay, you're talking about some marginal progress over the last couple of weeks. Are you concerned about the festive season? There's going to be lots of travel. Upcountry will be coming into contact with our elderly parents, grandparents. What do you see, particularly next week?
So what we see is that, of course, again, as we said before, the virus travels with people. The virus doesn't travel on its own. And the virus, thrives best when multiple households meet. So if you have a community where there are 6 households that come together, the chance of infection is lower than when you have a challenge where you have 100 households coming together. So the more households gather from different places, the more the chance that actually the transmission of the virus will happen. And the more they gather in closed spaces for a long time, the higher the risk of transmission. And those are factors which obviously we know are the factors that play during the festive season. People will travel from different places and get together, friends and family. And that increases the chance that the virus is going to travel further, faster. Therefore, we need to pay attention. As you ask, what does this mean? It means that we are going to see an increase in infections. It's as simple as that. Now, that increase may be seen maybe 2 weeks later or so, because there's always a lag to when people meet and when the infections surge start to happen. So the thing to watch is as people travel and meet each other, the thing to watch is time of gathering and number of people gathering. Those are really the things to watch. And finally, the obedience or adherence to the measures that help us to reduce the transmission, like masks, reducing social gathering, shaking hands or touching each other, which is basically contact. So those are the things you'll need to watch so that we avoid this kind of predictable increase in infections.
Absolutely, and that's some good advice, for the citizens as they, move around and try to hopefully, enjoy the festive season, but while still adhering to the protocols. What about for the authorities? What's your final word to them? Hoping for a return to schools on the 4th of January, as has been announced and planned. What needs to happen, at least from the end of the authorities towards making this a safer festive season?
So, Yvonne, I think the first thing I would like to say is that it's actually a dual track. The most important response will be from the people themselves. I have seen, and I can assure you this, I have seen places where, people really don't, as long as you can avoid the police, it's fine. You've seen places where social gatherings or bars and stuff are supposed to close by 9, but as long as you can close the door and the police don't see you, it's fine. So the first important response is from ourselves, the citizens themselves, to make sure that they question this behavior of themselves. They question the facilities that extend the beyond the curfew hours, that it's not a policing issue. It's a social responsibility issue. It's a morality issue, which is love for self and love for others as well. The second response is the state itself, that if we are going to see people gathering, especially particular days where we know that people are likely to stay long, the state can consider actually increasing the curfew hours for a short time and saying instead of curfew at 10, bring it down to 7 for a few days when you expect that gatherings can be massive, and then after that you open it up, not for a long time. It's really just a measure to control. It's a short circuit, or circuit breaker measure, a very short period where you can extend the curfew down to 7 and then back to where it is right now, and continue to support people, not to brutalize them, to support people to be able to respond to the measures by making sure those without water and soap have it, making sure those without masks have them, and making sure that information from the community upwards is available, that this is not purely an instructional issue.
Thank you very much, Dr. Githinji for your very valued advice.